the Omicron sample.
No, la verdad que me preocupa mucho porque, bueno, nada, ya vivimos el tema este del COVID, que estar encerrados y todo, y la verdad que nada, se complica un montón toda esta situación.
سمعنا برشا بلدان سكروا، سمعنا برشا بلدان عملوا برشا احتياطات، احنا ما عملنا حتى شيء وان شاء الله ربي يكتب الخير وكاو.
Pues con la nueva variante parece que todavía esto va para un poco más de tiempo.
It seems we're back to square one again almost.
The old one was going to be 72 hours and they changed it to 24 hours, and we had already booked our tests within that 24-hour window. So some nerves before they actually announced what the new changes would be.
Nobody's confident. Nobody's confident because we don't know after Omicron what's going to come next.
जामनगर में से मिला है वो ओमिक्रॉन वेरिएंट में पॉजिटिव मिला है.
I want to fight against COVID on new wave, no, Omicron.
Fear, anxiety, and many questions that remain unanswered. When countries across the globe finally started opening their borders, a new, heavily mutated COVID-19 variant emerged once again. Omicron was first reported to the World Health Organization from South Africa on the 24th of November 2021. 2 weeks later, the variant has reached more than 52 countries with 57,000 plus suspected cases being reported. Several countries have moved to block flights from African countries following the discovery of the Omicron variant. But the variant appears to have reached in every corner of the world. On the show today, we answer all your questions about the SARS-CoV-2 Omicron variant. How deadly is it? Is it different from other variants? Can it erode the protection of existing vaccines? And what should you do if you contract this virus? And how can it be tackled? The World Health Organization declared the newest mutation of the Wuhan virus to be a variant of concern on the 26th of November.
Omicron's very emergence is another reminder that although many of us might think we're done with COVID-19, it's not done with us.
Researchers are still trying to figure out its characteristics and what sort of threat it poses. When the Delta variant started circulating across the world, the majority of the population had not been vaccinated. This was true for India too, where it was first detected in October 2020. It led to a massive second wave of COVID cases in the country. But that has changed now. Around 42% of the world's population is fully vaccinated. So why did this new variant emerge?
As long as the virus continues to spread, it will continue to mutate and variants will be generated. So in anybody who's infected, these variants are generated all the time. It's just that some of them will rarely have an advantage in terms of being more infectious or indeed able to get around some of the body's immune system. Clearly, there is an issue about relatively low levels. Only 24% of the population in South Africa are fully vaccinated. We're still not sure exactly whether South Africa was where this variant originated, but one thing is for sure is that the more people who are fully vaccinated, the less chance the virus has of spreading and the less chance that virus has of changing.
There is growing evidence that the new Omicron variant of the coronavirus is capable of spreading rapidly. But the important question is whether the Omicron strain can make you sicker than the Delta variant. Can it also lead to a collapse of healthcare systems?
We're not sure at the moment how more deadly or severe Omicron is. We're seeing early reports from South Africa that most infections are mild and that individuals who are hospitalized are staying for a shorter period of time in hospital and don't necessarily need ventilation. So the hope is that Omicron is a relatively mild infection, but we still don't know. What's for sure is that it's very, very infectious.
So this is not only my data, it's also for the other general practitioners practicing in and around Pretoria, seeing more or less the same picture that I am seeing. Very, very mild symptoms, meaning that we can easily treat them at home. So far, I'm not aware of any of my colleagues needed to put any of these patients on oxygen. Their oxygen levels very, very stable. We're not saying that there will not be severe disease going forward. For now, even the patients that we have seen that who are vaccinated have mild symptoms. The whole picture might change going forward.
A past coronavirus infection appears to give little immunity to the new Omicron variant. The variant's swift rise in South Africa hints that it has some capacity to evade immunity.
The Omicron variant is likely more able to cause reinfections because it has developed a lot of mutations that allow it to get around some of the immunity that you get after a prior infection. And this is not surprising because of the number of mutations that are there. And we know that reinfections with coronaviruses are common in general. And it's also the case that this likely is a variant that evolved particularly because it was trying to evade immune responses. So this might have been a variant that was in a person for a very long period of time, or maybe in an animal for a very long period of time, and evolved in a way to get around some of the immunity that infection provides. So this does seem to be something that reinfects at a much higher rate than other variants, and that may be why it's increasing its prevalence, even though South Africa has a high level of prior infection.
And what about people who have been fully vaccinated? Current vaccines are expected to protect against severe illness, hospitalizations, and deaths due to infection with the Omicron variant. However, breakthrough infections in people who are fully vaccinated are likely to occur. Vaccine breakthrough infection happens when a fully vaccinated person gets infected with COVID-19. For example, in India, one of the first few people to be detected with Omicron is a 46-year-old doctor from Bengaluru who was fully vaccinated.
The people that were vaccinated have between light, very light, and mild disease. So for sure, it seems like people that were vaccinated are well protected. Whether they cannot be infected, it seems that they can be infected. However, they do not develop, as of now, very severe disease. It means that it might be the case that this new variant is capable to infect even very effectively. However, its many mutations maybe also affect the severity of the disease.
The Omicron variant has been detected in at least 55 countries, but no deaths have been reported yet, and most patients do not need supplemental oxygen. So there's no reason to panic. Let's hear what the medical advice is for people who get a positive test result.
The isolation is absolutely important. Now, because it is milder, people may be asked to isolate at home and take home care. But then they would have to be in a separate room with a separate toilet so that they do not infect others. But this is a highly infectious virus, which even through aerosols can spread from room to room. So everybody else in the house must be wearing masks, and the patient also must be wearing masks so that even aerosols do not form and drift from room to room. Then, of course, the question is, even if the illness has actually sort of subsided in 2 to 3 days, how long will a person be infectious after that? How long will the person be discharging the virus after that? That is not clearly known. That information still is being gathered, but it is best to assume that the person is likely to be infectious for at least 7 to 10 days and then keep isolated and have home care till then, rather than venture out into the street or start infecting other people without masks. So I think some of the precautions that we advise for Delta will still remain intact, even though the illness is milder.
One of the mysteries of COVID-19 is why the virus seems to affect children differently. While there is no data to show that kids are not susceptible to COVID infection, so far the outcome for young ones have been reassuring. But now, with Omicron, experts believe that children may be at a greater risk of contracting the virus and experiencing symptoms. Look at this data released by South Africa's National Institute for Communicable Diseases. It shows that 52 infants under age 2 were among 452 COVID-19 patients admitted in Tshwane, the metropolitan area that includes the capital Pretoria, a higher number than for any other age group.
Apart from the very rapid spread of this more infectious variant, is the fact that in South Africa they are reporting infections in youngsters, and by that I mean children under the age of 5, some of them getting quite sick. Now again, how common that is, we don't know. Whether that's something, again, to do with that particular population, the level of immunity, other types of infections or comorbidities in that younger population, we just don't know. So it's early days. It would be wrong to assume anything at this stage other than this is a very infectious variant and we need to do everything we can to stop it spreading.
So far, very few countries have rolled out COVID-19 vaccination programs for children. In October, the US Food and Drug Administration authorized the emergency use of the Pfizer-BioNTech COVID-19 vaccine to include children 5 through 11 years of age. It is already approved for use in those aged 12 and above. Other countries where children are getting vaccinated are Greece, Italy, Spain, Sweden, Finland, Switzerland, Canada, Argentina, Cuba, Colombia, Russia, Norway, Bahrain, Israel, and Saudi Arabia. The new variant comes at a time when many schools have finally restarted physical classes, but parents are undecided over sending children back to school. What should they do? And are there any special precautions that need to be taken to protect children?
Aside from the fact, which I know is difficult in certain countries, to begin a vaccine rollout in younger children, I think we just need to be aware of other measures that can stop the spread of the virus. This is difficult. It does mean wearing face masks in crowded spaces and in schools. It does mean also some form of social distancing, but it does mean increasing ventilation. We know that if you're indoors in a school or a house and you have poor ventilation, that can encourage the virus to spread. And just a little bit of ventilation can make a very big difference, particularly with the virus that's aerosol, it's spread through aerosols. So I think one needs to think about other measures to contain infection and to protect the youngsters. And if you're in a household where your adults are fully vaccinated, then you should be safe, but you need to think about other situations like schools.
We have data to suggest that the majority of children have shown antibodies, which means that they have been exposed to the infection. So I think the question here is not the children who have not been formally vaccinated or the efficacy of vaccine. The question here is whether the strain when it is introduced is able to escape the immunity provided by Indian vaccines locally as well as the infection.
Omicron is a heavily mutated strain of the coronavirus, and researchers are scrambling to learn about the variant's transmissibility and severity. Early reports suggest Omicron may not be more dangerous than other variants. But is it more contagious? And what are the symptoms of this variant? COVID-19 and the flu can cause similar symptoms. However, there are several differences between the two.
There is sufficient evidence that is now available of the nature of the illness being milder than that of the Delta variant. It appears that the symptoms are also somewhat different in the sense that body aches and headache and nausea are quite predominant. There is also dry cough like expected from any respiratory illness, but the kind of breathlessness that is seen, for example, in the Delta virus infection, which affects the lungs quite considerably, that is not really there. But extreme fatigue and exhaustion are the hallmarks, and many people are not even having other symptoms. They're only turning up with a sense of fatigue and exhaustion, and on being tested, they're being found positive for Omicron.
So this might be actually a sign that the virus is actually adapting better to the human population, causing milder illness, but maybe spreading more quickly. But that's almost like a natural immunization schedule.
Viruses constantly change through mutation, creating new variants which may have different characteristics. Timely detection of any variant is key to containing its spread. How effective are RT-PCR diagnostic tests in detecting this new strain?
Most of the PCR tests can be used actually to detect Omicron. So the way that works is the PCR test currently targets 3 regions of the genome, and one of them in the Omicron is deleted so that you you don't get a signal from that particular part. It's part of the spike actually. So these are S gene dropouts. So basically the PCR test comes back and you can actually see that 2 regions are positive and 1 region of the genome is negative, and that is almost a signature for Omicron. Obviously what we're doing here, if you have the capacity to do this, is going on to sequence to be sure, because that same dropout, that same change was true of the alpha variant. We know in this country, in our UK, we've got very low levels of alpha, but at the moment, people are using this S gene dropout as a surrogate in the PCR test, particularly if you don't have the capacity to sequence every PCR positive sample you get, which of course is a very, you need a lot of capacity to do that.
The actual characterization of the variant will depend on genomic analysis, but we must recognize that RT-PCR itself has about 60 to 70% sensitivity. It's not 100% capable of picking up every infection.
According to the World Health Organization, existing vaccines should still protect people who contract the Omicron variant from severe symptoms, and that there is no evidence to support the need for new vaccines, specifically designed to tackle the Omicron variant. But according to the research head of a laboratory at the Africa Health Research Institute in South Africa, the Omicron variant can partially evade protection from 2 doses of Pfizer and partner BioNTech's COVID-19 vaccine.
Alex Siegel has found in his lab that Omicron may escape some of the immunity that the Pfizer vaccine causes. That's the main finding. At the moment, we need to learn much more about what the implications of that finding is and whether this will hold true in terms of protection of people after Pfizer vaccination. We still believe that the vaccine will protect against severe disease and death.
The study showed that blood from people who had received 2 doses of the vaccine and had a prior infection was mostly able to neutralize the variant. suggesting that booster doses of the vaccine could help to fend off infection. BioNTech and Pfizer also said a 3-shot course of their COVID-19 vaccine was able to neutralize the new Omicron variant in a laboratory test, and they could deliver an Omicron-based vaccine in March 2022, if needed. So the question is, will other pharma companies too come up with a third dose?
Yes, so I think what's going to end up happening with coronavirus is it will continue changing for a while, but the hope is that we can keep on top of it, and the way to do that is by modifying the vaccine, and it's likely, I suspect, that for the foreseeable future we'll have to have at least annual vaccinations, annual jabs, to protect us. This is what happens in many countries with the influenza vaccination every year, because flu changes every year. It just changes in a different way from coronavirus, but it changes to an extent whereby you need to have modified vaccines. The hope is eventually we'll get to a stage where the virus settles down and is only causing mild disease, mild infections, and there will be no need for vaccination. But I think for the foreseeable future, the virus will continue to change, and we'll have to keep up with it by developing vaccines that can accommodate those changes.
Basically, what has happened is that experience from Israel and United States, mostly with the Delta virus, not with the Omicron virus, has shown that the immunity wanes after some time, particularly with the mRNA vaccines. It does not wane as fast with the virus vector vaccines, and we do not know yet how fast it wanes with the inactivated virus vaccine like Covishield. But most of the experience reported has been with the mRNA vaccines, with the Pfizer vaccine immunity wearing even after 2 doses, after 4 months are over from the second dose, and for the other vaccine, which is the Moderna vaccine, after about 6 months or so. But assuming that the vaccine immunity starts waning after about 6 to 8 months in most cases, boosters have been recommended. But even there is no clear evidence that the boosters are really required for younger people who have strong immunity or for people who do not have immunocompromised conditions.
The holiday season has arrived with a new variant and a rise in infections. Are public health officials discouraging travel and holiday gatherings this year too? Are new guidelines needed to deal with the Omicron variant?
We are in the middle of a pandemic and we have to know what can we do. I would say mask and masks, isolation, hygiene, everything that we knew 100 years ago. It's effective, it's important, and it's easy to implement.
Currently, the WHO is coordinating with a large number of researchers around the world to get a better understanding of the new variant. Omicron is still in its early days. It is hard to predict how it will evolve in the next few months.
Yeah, it's hard to know whether this is the last mutation. I suspect it won't be. What's interesting, of course, and people are speculating now, is if this Omicron variant does result in more mild disease, more mild than Delta, which is a possibility, and it spreads more across the world, is that a good thing? Because it means that we're out-competing a more disease-causing variant, the Delta variant. We don't know that yet. I suspect the virus will continue to mutate, but it will get to a stage where it cannot change much further.
First of all, collecting data, knowledge. Without knowledge, we are walking in the dark. So as every day we know more about the viruses, this virus and this Omicron, and clearly within maybe 2 weeks or no more than 3 weeks or something like that, we will know much deeper understanding of whether our antibody in our body is really fighting effectively against this virus. This cannot be done in 2 days, but in 3 weeks or 2 weeks.
The broad consensus is that COVID-19 will move out of the pandemic phase and into the endemic phase, which means that though the virus will keep circulating for years, the infection will be manageable and not as deadly. Scientists studying the evolution of the coronavirus say the only solution is to vaccinate widely and rapidly.
I think we've got a situation where we can manage infection, but what we need to do is to make sure that we get vaccines out across the world. As I say, this is a wake-up call for what we know is important, that whilst governments, of course, need to manage the pandemic locally, they have responsibility to their own population, I think what this highlights is the fact that we have to vaccinate the world and we need to deal with this globally. So it has really shone a light on the issue of vaccine equity across the globe, and the fact, as we keep saying, that none of us are safe till all of us are safe.